Okay, I think we should start the session now. Um, uh,
It's a bit dark there.
okay, so I'll start real quick. Very good afternoon to our invited guests, forum panelists, senior management team, fellow colleagues of Pantai Judo Specialist Center, and also from Jurong Park Medical Center, JMC. Thank you for joining us today in this Movember virtual forum on men's health awareness, brought to you by PJSC. So before we begin, I would like to invite Ustaz Haji Iskandar bin Habib Shah, our religious officer, Pantai Jedong Specialist Center, to recite Surah Al-Fatihah. Ustaz.
أستغفر الله العظيم الذي لا إله إلا هو الحي القيوم وأتوب إليه. أستغفر الله العظيم الذي لا إله إلا هو الحي القيوم وأتوب إليه. أستغفر الله العظيم الذي لا إله إلا هو الحي القيوم وأتوب إليه. إلى هدرة النبي المصطفى رسول الله صلى الله عليه وسلم، ثم إلى أرواح أزواجه وآله وأصحابه، وإلى أرواح والدينا ووالديكم، وإلى أرواح المسلمين والمسلمات والمؤمنين والمؤمنات معلمين المعلمات كافة عامة. الفاتحة. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
All right. Thank you, Ustaz. So November is the month where we all actually take a step back and to appreciate our fellow men. Not just to appreciate, but actually to put more focus in terms of their men's health during this month. So we dedicate this month to increase awareness on men's health issues such as prostate cancer, testicular cancer, and also men's mental health. So famously known as Movember, men are growing mustache during this month to send a loud and clear message to everyone that men's health is very important for us to take action upon. Not then, not in the future, but actually take action now. So PJSC here, we highlight cancer burdens in Jerusalem. We spread awareness about male cancers, and also we emphasize on the importance of early detection and cancer screening for the community. So we encourage everyone to normalize speaking about men's health in this month of November. Our chairperson also shares the same sentiment. So allow me to share you this opening keynote. Here is Dr. Babu Sukumaran, chairperson of the PJSC's November 2021 campaign and the director of the Brunei Cancer Center.
Invited guests, ladies and gentlemen, senior management, and fellow colleagues of Pantai Jarudong Specialist Center. And a good afternoon to everyone. Health has always been an important conversation that needs to be put forward within our community, regardless of gender. Generally speaking, or at least in my own experience, men are less likely to talk about their health, let alone seek treatment or help for any underlying disease when compared to women. This realization led to the creation of the Movember movement. The Movember movement involves the growing of mustaches during the month of November to raise awareness on men's health issues such as prostate cancer, testicular cancer, and men's mental health. This aims to normalize health conversation among men and encourages men to become more proactive about their health. PJSC is a center for the treatment of cancer, stroke, rehabilitative services, and various other medical procedures. We are in full support of increasing awareness of men's health and men's mental health in our forum today. Despite the COVID-19 pandemic, we are blessed to be able to meet online and talk about men's health with a handful of capable panelists from various backgrounds. each bringing value to our audience today. We have oncologists on board to speak about cancer burden and state-of-the-art treatment of cancer in PJC. We have our health allies from REPAS of Ministry of Health to speak about cancer diagnosis and mental health. Lastly, we have also invited a patient and also a carer to understand their perspective on being diagnosed with cancer and the challenges and the support that has to be given during their treatment from their family, community, and PJSC. I urge everyone to take this opportunity to ask questions, seek clarification, and do a bit of sharing with our panelists, with each other. With Movember being held every year, I hope together we can slowly debunk the deeply embedded idea of men should not talk about their struggles or illnesses and start telling everyone that it's acceptable to open up and seek help. Let's all make a common place to start conversation on men's health issues in our circle of friends and family and proactively spread the awareness. Fundamentally, after this forum, the responsibility to educate others lies on our shoulder. An honor to be part of this forum, and hopefully we can host a bigger physical event with more activities next year. Hereby, I would like to take this opportunity to thank the organizing committee for taking up this responsibility with many other organizations around the world to create a platform for men and men's health. Lastly, show your support, grow a mustache, and commemorate the initiative, and do not be afraid to speak up. Let's all normalize conversation on men's health, and together we can make a difference. Thank you for being part of the Movember campaign. Thank you.
So thank you, Dato Babu. All right. Without further ado, let me just quickly introduce myself. My name is Nazdani Ardian bin Haji Johan. I am with the PGS's Marketing and Public Relations Department, and I will be your moderator for this afternoon. Our panelists are an assortment of doctors, healthcare professionals, patient, carer, who have each their own experience to share. Dr. Ravi Sekhar Patnaik, consultant medical oncologist from Pantai Gedong Specialist Center. Dr. Haji Jamsari bin Haji Khalid, consultant radiation oncologist, also the head of radiotherapy department in PJAC. Dr. Lin Aung Han, senior medical officer, Department of Urology from Raja Isteri Tenggaran Anak Saleha Hospital, Ministry of Health. Haji Muhammad Daniel Azizi bin Haji Mahadi, clinical psychologist from Raja Isteri Tenggaran Anak Saleha Hospital, Ministry of Health. Tuan Nas Adamuddin bin Abdullah, and also Puan Najah Jamila bin Haji Muhammad Tahir. Welcome everyone, and thank you for agreeing to become a panelist for our forum this afternoon. So, to start, let me throw one quick question to Dr. Ravi just to get all things moving. What's all this commotion about Movember? Dr. Ravi, please.
Thank you, everyone, for joining on in this Friday afternoon. You heard it right. This is Movember, not November. Basically, people did question me, why do you put such a scary figure? Nobody can show a mustache better than Salvador Dali. So Dali is known for the mustache, and November is known for Movember. Movember is basically a blend of two words, mustache and November. So this was actually started somewhere down the lane in Australia. It was a charity group by two friends, probably got drunk in a pub, and then they thought that men never talk about their own problems. So let us form a charity and talk about men's health issues. As earlier told by Dr. Babu, that basically men's health, we never go out, we never speak about. So in this month, let's raise this awareness by growing a mustache, talk about men's health, which includes the prostate cancer awareness, which includes the testicular cancer, last but not the least, the mental health. Because most of the time we think men are somewhat stronger than the female. So unfortunately, it's no. That's what our psychologist will be speaking later, that how it's different. Men are actually weaker sex than the females. I hope I'm right, Danny, about Movember.
Yeah, that sounds pretty much right. If you do a bit of reading, anything, November is generally more on men's health awareness. So it seems that everyone is putting their own effort during this year's November. I feel of events, I feel of campaigns going on from other organizations or even individuals growing their mustache. I take it that in PJSC, sorry, there are many activities that's been done to boost public's awareness. So I'll throw this one to Dr. Jamsari. Dr. Jamsari, could you share with us a bit of what's going on in PJSC in terms of Movember? Take it away.
Assalamu alaikum. Thank you very much for your question. So, as you're fully aware, this is our second year of promoting men's health, Movember in PJSC. We've gone to leaps and bounds, basically. And last year we did a lot of road shows and went to a few places. And this year, because of COVID, unfortunately, we were not able to do so. However, very grateful of PJSC to promote this on our social media platforms such as IGs and Facebook. And we really are a focal point this year to promote men's awareness. So I'm very pleased to be part of it. Thank you.
Okay, thank you so much, Dr. Jamsari. So another aspect of November, just now as mentioned by Rafi, is actually mental health for men. So question for Daniel, can I call you Daniel? It's okay?
Yes,
In
yes.
your all right, in your opinion, Daniel, how has Movember helped mental health and has helped mental health agenda in Brunei to probably grow bigger or so?
Okay, so in short, actually there's quite a lot. So it really helps us as the mental health professionals to move our agenda forward. As what how previously the doctors explained, it also gives us a platform not just to talk about the men's physiological health, but also about their mental health in a more open and in a more safe discussion. So even though the Movember, just the name itself, mustache and November, even though the idea seems trivial and to a certain extent, we can find it a bit silly. However, I feel like it just hits the right spot in bringing up the topic, like very serious topic about men's health in general, which we can agree because as men ourselves, it's not that easy an open topic to talk about in a public settings most of the time. So one good example that I can come across with was an individual that I come across during that time. He was joining Movember, so he was growing out his mustache, but unfortunately, his mustache was not really growing because he wasn't really privileged to have the biological factor to actually grow his mustache. And then he was being advised by the mom to actually just shave it off. However, because he was insistent in joining the Movember platform, so it actually brings up the discussion between the mom and himself, so between the child and the parents regarding mental health, regarding men's health awareness in general, and not just that. He also bring up this topic to his other friends, which further catapulted the discussion further along. So I think it's one of the better ways for us to actually talk about this issue in an open space, and not just that. I also think it's in regards to the social media aspect, because it actually encouraged people to share their experience, and for the followers in the Instagram, in TikTok, YouTube, or whichever platform that they use, it helps people to understand the mental health difficulties that other individuals are facing, and it helps them to reflect those areas upon themselves. So this is actually quite evident in the number of referrals that we've been accepting in Repast, as well as the number of crisis calls for men under Talian Harapan over the past few years. So as a mental health professional, we are very happy to have this platform as a way for us to further our cause. Yeah.
Thank you so much, Daniel. So I think the mustache itself is a conversation starter. When you see one day, 1 month, a person has no mustache, then the next month in November, you have a mustache, then you want to ask, what's going on? What's up with the mustache? So it does open up a gateway for you to talk and then start talking about men's health. It's really promising to hear that many more men are opening up and seeking help. There is no doubt Movember played a part in getting us where we are now, for cancer awareness. So growing a mustache is currently the current trend, as I would call it, an awareness vehicle for Movember. But in essence, it actually seeks to spread awareness on men's health issues like prostate cancer, testicular cancer, and men's mental health. So a question for Dr. Ravi. Perhaps would you be able to share with us a quick overview on the cancer burden in Brunei Darussalam? And what are some common male cancers that we have here in Brunei? Is it the same as other countries or is it different? Dr. Ravi, if you may.
Thank you, Danny. WHO has put in basically as cancer being number one cause of death all over the world, of maybe number one or number two in most of the countries, roughly around 150 odd countries. If you look at worldwide, the incidence has increased 47% increase, projected increase from 19 million to 28.4 million by 2040. So we're looking at a lot of cancer cases, which is going to, we are going to inherit in a way. The same picture, if you look at in Brunei, probably it is much beyond that, what we are looking at. If you look at in a Brunei picture, the projected 2040, we are looking at a 108% increase. That means when we are looking around 2019, some thousand odd cases, we're supposed to get something around 2000 odd cases by 2040. And this is not our figure. This is a WHO figure which they have projected. And if you look at the death rate which we are looking at, not to scare you, but yes, we are looking at something around 400 cases would be going roughly around 1000 odd cases. So we are looking at a 160% increase in cancer cases in Brunei. So this puts us into a situation where we have to look at, are we missing somewhere? Are we missing on early detection? Are we missing on proper treatment? Are we looking at some cancers which are more prevalent here? Unfortunately, the cancers which we see in the world are the same as what we see in most of the developed countries. Basically, you are seeing in Brunei the number one cancer for males is colorectal cancer, then comes the lung cancer, and then comes the prostate cancer. So roughly for the males, if you look at, we comprise 45% of all the cases, new cases seen in Brunei, 45% are male cancers. And unfortunately, 52 to 54% of death, cancer death, is attributed to male sex. So it means males are more prone to die of cancer than the females. So there is no gender bias or whatever. Why this Movember concept comes in, we somewhere down the lane have been looking female-oriented cancer programs, female-oriented cancer screenings. No one has ever thought about male to suffer and male to need a screening program. So the colorectal cancer, roughly in Brunei, if you look at, there is 1 in 20 chances for male to get a colorectal cancer. Lung, it's the same, around 1 in 22. And prostate cancer, in this region, if you look at, we stand somewhere around 1 in 27. Worldwide, it would be 1 in 9. So this could be somewhere because of lack of screening, lack of people coming forward, or maybe somewhere down the lane, the clinicians themselves are not educated enough to screen for prostate cancer. So if we, as Dr. Jamsari was saying, he will be sharing some of his thoughts. As we go on seeing more, it's probably because of more screening to do these cases. In Brunei, these are the three cases which actually take the limelight. 1, 2, 3, colorectal, lung, and prostate. Thank you, Jenny.
All right, so those are some really for me it's a bit eye opener. Those figures itself shows that we'll probably double in number of cases in 2040. So I take from that is early detection and prevention is always the best course of action for cancer. So you detect it early, find out early, and we'll seek out treatment that could treat it better. We have heard that you mentioned regarding the top three cancers of colorectal, lung, and prostate. However, an equally important question would be here is, how do we detect and treat these cancers? Probably a doctor will be the ones who will examine the patient and to make sure whether they do or they don't have cancer. But as an individual, what can they look for? What kind of signs and symptoms do they need to look out for? So, Dr. Ang, probably this one is for you. Signs and symptoms of prostate and testicular cancer. What should we look out actually for as a man? So, Dr. Ang?
Yes, good afternoon, everyone. I'm Dr. Aung from Rebus Hospitals. So, it is very important to aware the early symptoms of these man-specific cancers, especially the prostate, testes, and I also like to highlight a little bit about the benign cancer, which is at the end of my presentations. No? The first one is the prostate cancers, which is a very high incident not only in the Western country but also in Asian country as well. We are seeing the increasing trends. No? The earliest signs of the prostate cancers, unfortunately, there is no earlier signs. They usually grow silently. So the affected individual may not know that he has a cancer in the prostate and he may feel fine and he may look healthy. But as the cancer grows gradually in his prostate, then the individual will have a spectrum of the symptoms, what we call the lower urinary tract symptoms. In this spectrum, the patients will have the very difficult to pass urines. He has to strain, and then his urine flow becomes very weak and thin, and he may have to visit toilet most of the times, what we call the frequency, urgency, and especially at the night times, he might have to get it more than 2 times per night in order to empty his bladders. So these are the very early symptoms of the prostate cancers. And if we neglect these symptoms and if we allow these cancers to grow gradually, then it can spread to the other organs. And in the advanced stages, then the patients will have tummy pain, pelvic discomfort, and then bone and joint pains. And very rarely, then he might notice some blood in the semen or blood in the urine. So these are the advanced features of the prostate cancers, and these are showing the affected individual has a very poor prognosis. Another thing is the testicular cancer. So, how the testicular cancer, in contrary to the prostate cancer, it usually affect the young individuals, especially the 20s or 30s, like that. For the affected individuals, the first symptoms that they usually complain is some kind of discomfort or pressures or heaviness in their hemiscrotums. This is their earliest symptoms. And then another common presentation to our clinical practice is these young individuals usually involved in the sport activities or physical activities, and then they suddenly notice there is a pain or discomfort in their testes, and they try to seek the medical attentions. And we did the examinations, and we noticed that there is some irregularity or abnormality in his testes. This is another common presentation to our clinical practice. Again, and in the late stage, if he failed to seek the medical attention, then it may spread to the other structures and surrounding organs, and then he might have tummy pain, back pain, joint pain, and if the testicular cancer is producing the chemicals, what we call the hormones, then he will have bilateral breast enlargements or bilateral breast pains. So these are the advanced symptoms of the testicular cancers. Another thing is testicular cancer may come to us with the loss of appetite and loss of weight. This is also a very common symptoms for the testicular cancers. And at the same time, I just want to highlight another cancer, though it is not included in this forum, is benign cancers. So benign cancer, I just noticed that the incidence is very low in Brunei, but it is a man-specific cancers, especially very common in Asian countries. So in the early stage of the benign cancers, usually the patient individual come to us with the ulcers or the sores which fail to resolve within 4 weeks. And sometimes the affected individuals may notice there's some bloody or the foul smelling discharge from the penis. Then these are the early warning signs. And finally, the patients with the benign cancers come to our clinical practice with what we call a condition called a phimosis. It means the skin covering the tip of the penis is very difficult to retract, and then especially in the elderly individuals, then this kinds of conditions, phimosis, may be related with the carcinoma of the penis. So these are the early warning signs and the advanced features of the male-specific cancers.
Thank you, Doctor. All right, I'll be honest. It's rarely for us to actually have a competition regarding these, and probably men maybe feeling a bit shy. They shy away from talking about this. But like as mentioned earlier, this is a good platform. So don't shy away from this information. Get checked if you do feel any of the symptoms, the earlier symptoms, then it's always good to just go to the clinic. Quoting a cartoon series in the 1980s, knowing is half the battle. So in our fight against cancer, knowing signs and symptoms give us give us the edge to better treat and manage the symptoms down the road. For this, I'll probably ask Tuan Adam. I would like to just ask probably your experience with seeing any of these signs and symptoms when you were diagnosed. So, Tuan Adam?
Right, thank you for this forum inviting me to be as a panelist. So it all started in year 2020 when I noticed there were changes to my body, uncomfortable sensation to my right testicle whenever I'm sitting, and I noticed this when I was in my shower. So I tried to examine my testicle. That is when I noticed the small lump on my testicle. I was quite anxious and curious, so I brought it to the hospital for a checkup. So that's all.
Okay, so see, knowing the early signs and symptoms has really impacted Atola, the early prompt action for Tuan Adam. A question for Tuan Jamila, same question. Um, were there any early signs and symptoms during the detection of your husband's diagnosis?
Assalamualaikum. To be frank, I was really ignorant about this cancer, prostate cancer. We came back from Umrah in 2016, and my husband has lost a lot of weight then, from Umrah, and his sugar level was high. We thought that it's because he's tired and all that. But then we went to the doctor said it's diabetes. But I reckon it's not so diabetes because his reading for his PSA then was 136. But the doctor did not advise him so much as to really press him to go to the urologist. He just said that you can go, or you might, if you choose not to go, it's okay. So that was in 2016. And then in 2018, in July 2018, my husband could hardly urinate. There was like 2 kilogram of urine in his bladder. It was causing him so much pain. You see, so finally we went to the doctor, to Suri Begawan, to Suri in KB, and we were told that, to go to the urologist in the past. We have to go. And by then it was too high already. It was like 422. Well, I think we should have sort of take it more seriously when we know that it is like, affecting his urination and his losing of weight and all that. I reckon, guys should be like paying more attention to that. Thank you.
So thank you, Fonaja, for sharing. So in Fonaja's case, there was weight loss, and then there's also a bit of pain. Then I think when it boils down to it, when in doubt, and it's also good to actually go with your gut feeling when you see the signs and symptoms, and then there is an opportunity to visit. I think it would be a good idea to just go get checkup. Maybe the doctors can recuperate whether that's a good right way to do. Whether you see signs and symptoms like this, is it good to immediately go or not go? Maybe one of the doctors can just quickly answer that one.
Hello, assalamu alaikum. This is Dr. Jamsari here. So very good questions, Danny. It is unfortunately a normal case where patients and men do present a little bit late. I'm hoping that from this forum and our efforts, men would come a little bit more forward. PAC screening is actually easily done. It's a simple blood test. So one shouldn't really be afraid about getting it done because it takes about literally 5 minutes. You don't even have to fast for it. And if you have a high PSA, the first port of call is to refer them onwards to the urologist. They will be able to assess the patient to see whether is it a normal enlargement of the gland, or is it really malignant. I mean, like, it's not necessarily cancer that would be that presents at the high PSA, but I think it'd be worthwhile doing a national protocol where anybody above the age of 50 should have a PSA once off, at least to get a baseline, and then subsequently you may want to check it over the next couple of years, every 2 years, every 3 years, depending upon symptoms. And as Dr. Ong was saying, that if you have such symptoms, you know, it may not even be prostate cancer. It could just be a simple enlargement and can be treated simply with medications. And we can talk about the biopsy later on, perhaps, Danny, down the line. Yeah, thank you.
Thank you, Doctor, for clearing that up. So basically, it's safe to say that when we have advanced a great deal from the kind of treatment that we do in the past for cancer and the kind of treatment that we do now, our cancer treatment and modalities are really, really much advanced. Don't you agree, Dr. Jamsari? So my question probably would be is, what are some of the new methods available today for new modalities for cancer and treatment?
Okay. Before we treat anybody, we would have to diagnose them first. Usually, upon seeing the urologist, there are two options: whether they do the ultrasound scan or MRI scan and consider biopsying the patient. Here in PJSC, we're able to offer our patients transperineal prostate biopsy. It is done under general anesthetic. So when men come and see me to have the biopsy done, they're completely asleep. It takes me about 5 minutes to do, and it's a very simple procedure. It's completely painless. So the rate of infection is very low, so one shouldn't really be afraid about it. And the way we do the biopsy is an ultrasound guided MRI fusion, where you combine both information from the MRI plus the ultrasound scan done in the day. And the MRI scan is usually done either in PJSC or in RIPAS. And it's a really good mode of investigation where we're using the latest technology with an MRI scan plus an ultrasound scan to do a safe procedure for the biopsy. So majority of our accuracy is very high. We rely heavily on the pathologist to help us as well at the same time. So we have an accuracy of over 95%. So once we biopsy the gland, if there's no cancer, chances are there probably isn't any. Thank you, Danny.
Thank you, doctor. So for those patients who actually just family members, friends, or patients who do feel a bit concerned or worried about going through these treatment procedures, I think you can be rest assured. Dr. Jamsari said it is safe, and no, it was painless because you're going under general anesthetic. So these are some of the things that probably I myself have heard from people that are worried going under the knife, for example. So going from Dr. Jamsari, I'll move on to a question to Tuan Adam. Probably you could share some of your thoughts and experiences during the moment that you were diagnosed with cancer. Probably, what were you feeling? Things that were going through your head during that time.
Okay, thank you. So when the doctor, when I brought up to the hospital, and the doctor told me about them diagnosing me with the cancer, and I was taken aback, and I was a total shock at that time. And my first reaction was no, I wasn't ready for this such a news. So the doctor advised me to start my treatment as soon as possible, but I refused to do so because I think like I'm still young and this is impossible. So after a years of refusal, earlier this year there's a swelling on my left stomach again. I brought it up for a checkup. The hospital did a scanning and found out that the cancer has spread to the other part of my body. Thank you.
Okay, so thank you for sharing. Again, this goes down to Atullah. The first part when you hear some news some impactful news that it's very hard for us to process. Being told that you have cancer is a big impact on on an individual. So probably I would like to ask Puan Haja Jamila, as a carer, Puan Haja, how has the news of your how has the news of your husband and can sorry, how has the news of your husband's cancer affected you and your husband and yourself? And what is the key thing or items that actually kept you strong?
Well, shock. Cancer is a taboo. Everybody is so scared of cancer. You never, you when you think that you've got cancer, it's like a life sentence. You see, you can never go right with cancer. It's always that you end up dead. Well, we were shocked. We could not accept it. But my husband was stronger than me. My husband was good. He did not shed even a tear until today. I was crying, crying, crying the whole week. And then I went to Mr. Google. I Googled a lot about prostate cancer. That's when I found out it's not that bad. So I reckon it sort of gave me some kind of comfort. And when we met our oncologist, he was so encouraging. He said, "Oh, this is okay. We'll just give you this and that, and then you'll be okay." I cried. I think I must appear like a fool to Dr. Ravi. But then, it was the best news that I've heard for 2 months. My fear for cancer for my husband. I've only got my husband, you see, we've got no children. And I don't want him to be suffering. If he suffers, I suffer too. So I reckon the impact was like, I just can't explain, but it was very, very miserable. I only think, I used to think that, it only happens to other people, not to me. We were happy. We were like doing well. We were happy. Cancer can't come to us. No, not cancer. But it did. And what do we have to do to keep us strong? Like I say, we only have each other. My siblings are far away. His siblings are even further in Bandar. But still, they're very helpful. But still, I think it's only like me supporting my husband and my husband supporting me. It's the main role of us staying tough until today. Whenever I'm sad, he will come to me. Ah, don't worry. It's just that, this is just a test, a trial for us. And he's but he's never down, so I have no chance to sort of comfort him. You see, he's never down. At most, he just say that, oh, I'm in pain. You see, so I'll just comfort him. That's about it. But again, I think the main thing that is keeping us strong is my religion. I'm sorry to say this because I'm not saying that this is, but I have to say this. We both of us are strong because we believe that whatever God gives us, there is something good behind it. See, the God let us have a good oncologist. God let us meet Dr. Jamsari too. He's very caring. Dr. Ravi is caring. We've got very good EQ. What more can we ask? So these all things like helps us to keep on going. We look forward to being healthy again one fine day.
Inshallah, for that, and one fine day. I think one more question for Tuan Adam. And how was your treatment journey in PTSD, and how has your lifestyle changed since then, Tuan Adam?
All right, thank you. Alhamdulillah, I guess my body accepting all my treatments, everything went well, and I don't have so much side effect during the treatment except for my second, I think for my second cycle, where I vomit every time. So my second, I had, and during my second cycle also, I had my dry and burnt skin, something like that. But nothing's more than the other side effect. And it really impacted my lifestyle, where I couldn't do so much, like unlike before this. I used to hike and run without any complication of breathing and easily feel tired. Thank you.
Thank you. So yeah, I think it's expected. I think after being diagnosed and then actually going through the treatment, it will take some time to go back to how things are, or probably at least as much as possible, maybe up to a certain level of how normal life was before. For Naja, would you want to share on how the treatment was here in PJSC and also life changes that you have to adapt to since then?
Of course. Well, I salute to the staff in PGSC, my oncologist, Dr. Ravi, Dr. Jamsari, Dr. Hamid, to name a few, who has treated my husband so far, and all the nurses. Like I say, they've got really good EQ, high EQ. Without them, I reckon we'll feel more miserable if you go to a place where you don't feel welcome and you don't feel there's hope. See? Um, Another thing is that lifestyle. Well, we tend to eat more wisely, not so much eating out because it's COVID time. Otherwise, we still do sometimes eat out, but not as much as before, I would say. I cook a lot nowadays. I have to, even though I don't like it. But I say my husband is an easy patient to care for. He is a good and patient. He never complains. He never sort of asks me to do this, do that, never grumbles, never, not fussy at all. So I have got no cause to sort of be miserable or what, and I say the only misery I feel when I care for my husband is when I see him like complaining about his backache. And like recently, in May and June, when he lost his appetite and he lost about 10 kilogram, that was sad. That sort of changed my lifestyle in the sense that I don't know what to do anymore. You see, I don't want to see my husband, you know, like, sorry to say, I don't want to see my husband like losing weight. And then, I try to support him again with religion. We agree that it is only God that can help us. So lifestyle changes also spiritually. We are closer to Allah. We thank Him for whatever we have been through. Like I say, whatever He gives is for the better of us. So that's it.
So I think so Ponaja is very fortunate that your husband are very strong, going through this together. And I think as a carer, if you have family members or friends who are going through this, uh, supporting them through their treatment, through their journey is one of the most important things that you could ever do. And listening from both Tuan Adam, Mr. Ponaja, Jamila, we can slowly try to understand the struggles for anyone who is diagnosed with cancer, needing to go through treatment and needing to go through this journey. A question for Dana. In your experience, is this something common that people go through when facing the stressful situation? Perhaps you can also share a general overview of mental health in Brunei.
All right, thanks, Danny. So I would say yes, absolutely. I would even go as far as to say it would be more worrying if the individual doesn't undergo through certain psychological reaction as they go through this stressful reaction in their lives. So if I can just invite everyone to imagine a simple analogy. So it's like imagine a water container. So you yourself is a water container, and then every time a stress comes in, there's like water being poured in. So up to a certain extent, if you keep bottling up all the feelings and all the water inside, the water is either going to spill or the bottle is going to break. So the breaking or the spilling of water is, we can accustom that to the manifestation of the psychological issues that we actually see in our daily life. So that's where our anxiety would come in, depression would come in, panic attacks and everything and whatnot. So I would say it is normal for Tuan Adam and Puan Hajah to experience the feelings that they felt. So for example, for Tuan Adam just now, there was a feeling of denial because it's true, somebody as young as me might not get prostate cancer. So it's acceptable for them to feel that. And it's true also for Puan Hajah Jamila to actually say things like, oh, I'm scared because cancer, to a certain extent, it can be a life sentence, especially with certain cancer. But fortunately, prostate cancer and testicular cancer, as we understand, is a bit more treatable. So, but however, the feelings that they felt is very much real, and the experience they experienced. So, because of course, sure, there's a lot of things that's on the line. So it's not just the physiological issue. When somebody is being taught cancer, it's not just the physical, because they understand there's a physical, what they call it, a physical factor to it. The person might be in pain and whatnot. However, there are other things that might be on the line. For example, the financial side. So alhamdulillah, in Brunei, our health punya area is a bit more secure because we get healthcare for free for most of us. However, for certain family, it will still create constraint to the financial side, because what if the man who has the prostate cancer, testicular cancer, is the breadwinner of the family? So they need to think about that. Who's going to take the responsibility after this? And not just that, if we think about it, quoting Puan Hajah Jamila just now, if my husband is in pain, I will be in pain. So there's this emotional attachment to this person. So because of course, when our loved ones are hurt, of course we will naturally feel worried about them and feel hurt about them. So each and one of these factors, the biological side, the social side, financial, the emotional stress, will create certain mental health issues as they go along. So having them to check whatever the possible cancer that they might be having, or having a good health professionals to consult them is a very important factor for them to actually go through these emotional stages. And also to answer the last part of the question just now. So regarding the general overview of the mental health of Brunei, so again, alhamdulillah, we have made quite a few progress over the past few years, especially in terms of the Mental Health Order, the Mental Health Order Act, and as well as the Talian Harapan, the establishment of Talian Harapan, because it makes it easier for the Bruneians or the people staying within Brunei Darussalam to actually access our help even more. And not just that, there's and I don't know if everyone realized, there's a couple of emergence of different community projects set up by the youth to actually put more awareness and put more spotlight onto the mental health stigma that we are actually experiencing. So as I said earlier, this was evident with an increase in number of referrals that we are slowly accumulating back in Repass. However, there are still some improvement that we can, of course, definitely improve on. So we still have certain mental health stigmas, such as labeling these people with mental health issues, such as having gila and everything. And also, not just that, currently, there's also, people understand about mental health awareness and the mental health stigma, but they still have the self-stigma onto themselves instead. So like if I can just give an example, yeah? So a person might be very supportive of another person, whether they have depression, anxiety, schizophrenia. So they will be like, I will help you, whatever you need. I will try to help you with any of the mental health professionals that you might seek help with. I will bring you there. I will be there for you. However, when it's up to them getting the mental health issues, so they themselves getting depression and they themselves getting anxiety, they will tell themselves like, no, I'm not the one, like I shouldn't be feeling like this because everyone has it harder than me. So they invalidate their own experience in getting the mental health issues so that they can justify themselves not having to seek the mental health professional. So these are some of the things that we might want to try to solve or try to manage as we go along. But of course, so to summarize, we are actually moving into the right direction. However, just like how everything else is, there's more agenda that we might need to improve moving forward. So yeah, back to you, Danny.
Thank you so much. That was really good to know. But several things, several new projects in Brunei. Two things that I'm taking out of this conversation just now that you're saying is it's okay to feel the way you feel. So as men, when you feel that you find symptoms either of cancer or you feel that you're unwell, it's okay to reach out and speak. And it, at the same time, when the other point that I wanted to make was when it comes to us, when it comes to someone else who has cancer or has symptoms, and we keep on advising them, oh, you should see a doctor. But when it comes to us, and when we have these symptoms, we start giving out this alasan, we start giving out this reason, or maybe it's not me, or maybe this. So you got to be fair. You're going to give advice to someone else. You got to be ready to take some advice yourself. So my advice to everyone is, of course, when you are ill, when you're sick, when you have the signs and symptoms, follow doctor's rules, go meet a doctor and get screened. So generally, it goes both ways. The mental health agenda in Jerusalem is indeed getting a lot of support from individuals, I take it, and a lot of the organizations, and from the government, from the projects that you were saying. Um, I think at this point, it is also true that cancer patients in Brunei are also getting similar support from the government, probably from the facilities that's available, with state-of-the-art treatment facilities in PJSC itself, for example. We are better able to treat them, and this is, of course, thank you to the government of His Majesty for allowing us to be able to have all these things. So, Dr. Ravi, a question for you. Men who are diagnosed with cancer, uh, men who are diagnosed with cancer will be taken care in PGSC, of course. But what are some of the new modality treatments here in PGSC itself?
Thank you, Jenny. We at the PJC is the only center in Brunei. Thankful to the HM for making such a beautiful center here. Like we have worked outside and we know how costly and how difficult to have all the things in one place. PJC is the only center where you have all these kind of super gadgets for diagnosing cancer. Like we have the bone scan, we have the PSMS scan, we have the state-of-the-art MRI. We probably are thinking in future to get something like a diagnostic treatment by the nuclear medicine department. Possibly these are the new, as Dr. Jamsari would say, the new toys for the oncologists. But to say that this is something which will improve the quality of life, improve the survival, and improve the care of the cancer patients in Brunei. So we have here, as I said, we have the bone scan, we have the PSM and PET scan. We also have few of the modalities which with treatment is done with radiotherapy. I think Dr. Jamsari will speak about that. Jay?
Yeah, maybe I can chip in. Thanks, Ravi. So basically, down in radiotherapy department, we're in the first floor of PGAC building, and we have two very good linear accelerators, which were the state of the art and still is. And we have a full complement of staff which were well trained into delivering radiation. And we're able to treat anything you could imagine, from the smallest of diseases to the biggest of diseases. It is normally done in conjunction with chemotherapy given by Dr. Ravi. And a lot of the time we work hand in hand together, plus our colleagues in RIPAS as well. So it is a multimodality treatment. The machine doesn't make it work, but the people around it are actually the most important. That makes the actual treatment work. So not just the hardware, but the software is very important as well. I hope that answers your question, Danny.
Yep. Yeah, it seems like that covers quite an array of the treatment modalities that is available there in PTSD. Thank you, doctor. So we're quite close to the end. So actually, we've got several more themes to talk about. We've covered types of cancer, we covered screening, we covered the treatment process. However, we have yet to dive into the prevention aspect of things. So, Dr. Ong, this is for you. What are the ways of us to prevent cancer and reduce the risk from getting cancer, especially testicular, prostate, and also renal, if you want to add on to that? Doctor, you were muted. Uh, yeah, we can.
Okay. Sorry. Thank you. Thank you for your questions. As the saying goes, the prevention is better than cures. So even in the man-specific cancers, prevention is quite important instead of talking about the cures. So the pursuit of the healthy lifestyles, which will include a lot of physical activities and balanced diets, are the most important things. Especially for the prostate cancer, there are studies, a lot of studies coming out that even 1 hour exercise per week can significantly reduce the incidence of the prostate cancer. So we should more involve, especially male individuals, we should more involve in the mild to moderate physical activities at least 1 hour per week. That is a very important uh, correlation between the physical activities and the incidence of the prostate cancers. Another thing is in men, especially our male individuals, what we call the health-seeking behavior is very poor. So we are very afraid of stigmas. We are very afraid of losing the masculinity, and then we are very embarrassed, not manly enough. That's why we are lack of aware the early symptoms of the, especially the prostates and then the testicular cancers. So we should keep in mind that the symptoms will not simply go away. So we should try to overcome the cultural and the traditional taboos in order to seek the medical help as soon as possible if there is early symptoms of these man-specific cancers. And in here, I just want to convey a very effective, what we call effective subtesticular examinations, very effective methods for the prevention of the testicular cancer, because I just saw a case in the forums one. No? So in this method, what we call the subtesticular examinations, it is very effective to prevent and detect the testicular cancer in the very early stage. So imagine this orange as your testes, especially for the male individual in the young individual. You know? It is a very easy method to detect the testicular cancer. So imagine this orange as a testes, and with this, using the both hands over the testes, you can use soft pressures to examine your testes every 10 minutes every month. In this way, you are accustomed to your normal anatomy of the testes, and then if you feel any abnormality or irregularity, then you will know that there is something is not something is wrong in my bodies, and you should seek the medical attentions as early as possible. So these are the effective ways to, in order to reduce the risk and in order to prevent the man-specific cancers. Thank you.
Okay. Probably later we can have a show on. Did you? Is there some material online about the orange testing? Or so we'll probably get back to you on that, doctor, because I think
Okay.
it's really important for people to do their
Yes.
testicle
So
examination.
okay.
Is it?
Yes. So I just want to show you again now. So imagine this is an orange. Imagine it is a testes, and then especially this test should be done especially after a shower or the warm bath. And after that, when you are in the relaxed conditions, using your both hand, keep your testes like that, and gently with the moderate pressures, you should feel your surface of your testes by using your thumb and the fingers. Not too rough, not too strong, just soft and moderate pressures. In this way, you will become accustomed to your anatomy of your testes. Very easy, not to spend a lot of time, just only 10 minutes per month. In this way, you will become to accustomed to the surface, and then you will feel if there is something abnormality or something irregularity on your surface, then you should seek the medical attentions as soon as possible. So this is what we call the testicular sub-examinations. So this practice should be encouraged, especially for the young individuals, because the testicular cancer incidence is quite rising. And for these cases, in this way, we can detect early cases, early testicular cancer cases. Thank you.
Okay, so I've heard of self-examination for breast cancer, and this is actually,
Yes.
I'll be honest, it's my first time actually
Yes.
knowing that there's a
Testicular
self
self-examinations.
testicular
Yes.
self-examination. So
Examination. Yes.
that is something that everyone should take note and probably
Yes.
bring
Yes.
home. All right, moving on. So knowing signs and symptoms is very important. In Dr. Ang's slide, is shared a bit of screening there. So Dr. Jamsari, probably a question for you. What more could one do to detect cancer early?
As mentioned before, I think the simplest thing, apart from the prevention that we're doing, is to be a bit more self-aware of your normal body functions. You know, if you find something going wrong, whatever it may be, simple urination or perhaps or pain, it's best to see a doctor early rather than leaving it to brew for a length of time. And you don't have to be afraid. It's just a simple chit chat with the local GPs, and they can do a simple blood test. And if they find anything wrong, again, it is not necessarily cancer. It's just about doing some regular investigations and not being afraid about what we have to do. And I think asking the right people is the most important thing. Don't rely heavily too much on WhatsApp groups or being afraid of some information online. I think it's important to just asking the right questions to the right people, and there are plenty of doctors and healthcare workers around to help everybody out.
Right. Thank you, doctor. So that actually boils down to probably screening. As you can see on the screen, get screen early and get detect the cancer early. So how maybe a question for Dr. Ravi this time around. Are all men susceptible to prostate and testicular cancer, or are there some uh, risk factors that we can actually just eliminate totally? Dr. Ravi?
Thank you, Danny. You see, uh, can I go to the back slide, please? The past slide. Yeah. As Dr. Jamsari and Dr. Ong did talk about the screening and early detection. Yeah, we look at screening and early detection for healthy individuals to find out if they have this disease. So what is health basically? So how do we be healthy? That is the most important thing which we have to be looking at. Do you know that the cancer itself, we have a 30 to 40% risk with this, particularly this tobacco and unhealthy diet or obesity, which is causing. So if you can catch these two giants out, so roughly 40 to 50% of your cancer, you may not get cancer. Why is it important in Brunei? We have to know that in Brunei, we still have 36% of the males are still active smokers, and smoking can cause roughly 40 to 30 to 40% of cancers. And some cancers, as I said, lung cancer and other, you have almost 80% association with smoking. Same if you look at obesity. Basically, Brunei population, I'm sorry, but it's a fact that we are number one after Malaysia. We are also number one in childhood obesity. So in this region, ASEAN region. So, and obesity itself is a reason for 30% to 40% of cancers are associated. 13 cancers are associated with obesity, whether it is male or female. So these two comprise 40% of all the cancers which could be prevented. And apart from that, of course, COVID has caused us not to go for hiking, not to go for cycling, not to go for exercise, not all the gyms are closed. So we are becoming more sedentary. So staying fit and active, at least 30 minutes, as everybody said, 30 minutes of any kind of an active sports or any kind of brisk walk or swimming or walking or doing some kind of physical activity would actually help you in preventing cancer. And to top it up, you should go for a screening, and that helps in early detection. Early detection. I'm sorry for the story which or the facts which you can see from the whole talk which has gone, where people have missed out, and we are landing up with people getting so much of an advanced disease. If we would have picked them at early or vice versa, we could have given them that smile back and we would have cured them. So these are few things, this is few learning points. I'm really apologetic from all our team to Hada Jamila and Adam or whatever, if we have done any faulted anyway. But this is the fact that somewhere down we have to be educated. We have to remove this taboo out. So if we go in for this screening and early detection, yes, we can beat this cancer out. That should not be a reason that cancer cannot be prevented. Cancer can be prevented. So, going to your question, Zeni, about what are for the prostate cancer, which are the risk factor. Being a male is a big risk factor, I would say first. So, if you're a male and you are aging, yes, you will get a prostate cancer. It's the same like we say, being a female, there is a very high probability you may get a breast cancer. Of course, males also get breast cancer. Don't take it that only females get it. Males also get. And having a strong family history, luckily we don't belong to that ethnic group where we can get prostate cancer. The prostate cancer incidence is low here. And the modifiable risk, which I talked about, the obesity, unhealthy diet, and smoking, which are the prime risk factors for prostate cancer. Testicular cancer as such doesn't have anything to do with, but it is something which we have to know that it is a tumor which happens in young people. So roughly around somewhere from 15 to 40 are the people, that's the number one cancer. So they have this undescended testis. That means the testis is not in the usual position when you see that it should be in your scrotal sac. That is not there. So that's where you first think that you can get testicular cancer. Either your brother, father, or your grandfather had testicular cancer, or some genetic abnormalities which can happen. These are few of the risk factors for testicular cancer. For penile cancer, usually we say that the most important for us we look at is an HPV. Then we have infections like HIV. Big infection is one of the risk factors for penile cancers. Circumcision and other has a positive help in not getting penile cancer as such. So it's more or related to infection which we attribute to penile cancer. That's Zeni.
Thank you so much, doctor. So was it like being, of course, you need to be a male, then you're more susceptible. Age is a factor. Probably to pick up from both Dr. Ang and Dr. Ravi mentioning about smoking. If you, it's very advisable to just stop smoking to reduce your risk of getting cancer. Obesity is also a risk factor. I know it's really hard to exercise nowadays, but I think we all can do 30 minutes a day just walking around the house. So after the end of the day, after today, maybe this weekend we can start since we're already open. Transition phase, get that exercise in every day. No alasan, no reasons for not to do it anymore. All right. So that is as a man, I would say be a man and get your exercise. Okay. So probably I want to touch one particular thing. So this is for Dana. Earlier, Pona Jamila shared some of her coping mechanisms on how she explains how she coped with the difficulties in her journey. Would you be able to tell us what are the things a person like Pona Jamila herself could do to go through any of these mental health hardships and issues? And maybe at the same time, pick out some myths about mental health that you picked up over the years.
All right. Okay. Thank you, Danny. All right. Yeah, that's always the question, isn't it? Like how do we solve this problem? So if someone can answer this, we can definitely nominate them for a Nobel Peace Prize. Actually, like one coping mechanism that can actually like one size fits all for everyone. So the answer that I have is basically it might sound like a cop out, to be honest. Okay, so there's no way around it. So the best coping mechanism for us to manage our psychological health is whichever is best for that person. Okay. Unfortunately, most of the psychological issues are not so much like physiological health or physiological issues. So, for example, if we have demam, okay, if you have demam and then we get pening and whatnot, so we have a headache, then we know, oh, just take a Panadol, just take a paracetamol, like pop those two pills in, and then in a couple of minutes, in half an hour, and then you'll be good to go. However, it's not so much like that for the psychological health. Because in general, if we're going to list down what can we use to actually manage with psychological health, it's basically almost everything under the sun. So we can include exercising, watching movies, listening to music, performing a specific hobby, spend time with your loved ones, journaling, and so many more. Okay, so but the efficacy really depends on which one suits best for the individual. So like if I share about myself, yeah, so how I would usually cope with the different stresses that I have in my life is basically mostly by exercising or going on for random drives somewhere. So no destination, just drive around, okay? However, some other people might think this is more stressful because they think like, oh, why would I want to go drive with no destination in mind? Like I'm just wasting my time. Or if I'm going to do some high intense exercise, I'm just going to get more stressful because it makes me realize how unfit I am. So again, my best advice is try everything under the sun, which is the healthy one, okay? Because again, it's not the like the dosage is the one that makes the poison, isn't it? So like if you exercise just the right amount, it's good to go. But if you exercise too much until it affects your other parts of your daily living, then that's something else lah, okay? So yeah, so just go trial and error and see what's best for you. So honestly, even us as mental health professionals, even within the therapy session, we would usually try to encourage the clients to try to find a way that they see which one suits them best. Because in the end of the day, even though we're the mental health professionals, okay, the real professional in somebody's life or in one individual's life is basically that individual themselves. So we can only give them advice. However, the specific way on how to do it will usually need to come from the patient or from the client themselves. And to answer the second part of your question, so okay, the myth. There's actually quite a lot. If we're going to go through each and one of them, it's going to be a whole another forum on its own. But two that really grinds my gears, basically. So the first one is we always think somebody with a mental health issues, we always straight away think they're violent and they're very physical, okay? So this has been a culture for how many years or for how many centuries, yeah? So, but the thing is, studies do show actually only about 3 to 5% of people with mental health disorder are actually violent or actually physical. And not just that, other studies even show that they are actually more likely to be a victim of like sexual assault, physical assault, or like taking advantage, being taken advantage of. Yeah, so one of the mental health organization in the US even quoted they are 10 times more likely to be ostracized by others. So we need to remind that to ourselves. It doesn't mean that somebody with a mental health issue doesn't feel bad if they get ostracized or if they get prejudiced. So because we will see this in just our normal everyday life. We hear something like, Jan ko dakat tu dengan orang tu, lain ulahnya, karang bumarah ko. You know? So the thing is, they haven't even done anything to us, but we already feel the need to distance ourselves away from them. We're already being prejudiced to them, but who knows, they're just like living their everyday life, you see? So we always have that mindset. So I think it's one of the things that we might want to change as we go along. And then another one also, the second myth that really grinds my gears is, a mental health condition is a sign of weakness. Okay, so it means that if the person is stronger, they wouldn't ever get mental health issues in their life. So as I explained earlier with the empty bottle analogy. So in that logic, okay, everyone. Every living person will eventually experience mental health issues sometime in their life. Okay, so the thing is, some of us are a bit more able, like we are more well equipped to actually undergo and manage these mental health issues at some point. So for example, like some of us might have a bit good social support. Okay, they have good social support, understanding boss. They come from quite a well-off background, and then they have access to all these mental health facilities and everything. However, other people might not be as privileged to have all these factors. So who are we to judge them for not being able to cope with the mental health issues and seeking help for something that they are not able to control? So yeah, so I think instead of just comparing us and them, we should really just try to support each other in terms of our mental health and try not to compare. Like, oh, you have it better because you have more money than me, but we never know what they actually, where that actually comes from. Yeah. So those are the two myths that I would say really is quite prominent around. Yeah. Thanks.
Yeah, thank you. So I take it this is also similar in the sense that being a patient now, being a patient for cancer, you get stigmatized, and also the other one you mentioned, the second thing that I would get the grind of gears is what was it again? Sorry.
So the fact that if somebody actually experiences mental health issues, some mental health problem, it means that they're weaker compared to the others.
Yeah. Okay. Similarly, relating back to cancer patients, just because they have to go through it doesn't mean that just because they got cancer doesn't mean they're the weaker. It's just it happened. No one could predict this. No one could ever tell whether it's coming or not coming. So if any of a patient or you suffer from mental health or either you're a cancer patient, these are some myths I think that you could relate to, that you're not weak, and at the same time. It's not okay to be stigmatized. So people like that, we all need to work together to push our community, our circle into the direction that really supports either clients of patients of mental health or patients of cancer. So I see those common things in both areas. But coping mechanisms, having your own coping mechanisms and routines actually supports the recovery process. Looking back, I think to Tuan Adam, just a question for you. Looking back at Tuan Adam, what are some things that you would do differently in your recovery journey? What would you change?
All right, thank you for the question. I think different approach, which mean other than scientifically approaches, I mean with the help of my medication, current medication, like treatments and whatnot, I would like to start a brand new lifestyle, a clean eating lifestyle, a healthy lifestyle, and a fresh lifestyle and appreciative lifestyle. A lifestyle where I want to be more cautious about my body intakes, and lifestyle where I clearly understand what my body needs and can nourish from. Because we don't always get this lucky, like the semua orang dapat adalah bernasib baik. And to be
Oh,
able
but
to
but
call ourselves as a survivor and to be given another chance for to see tomorrow. Like, thank you.
so I love the kind of positivity that Tuan Adam has shown, because like he said, he chose to look at it positively. That this is a second chance for him to be able to walk again in this world and then do things different. So thank you and well done also to Ponadam and so Ponaja, Jamila, for actually being positive throughout the whole journey. And that is something that we all could learn from. Like I said, there's many that we could learn from Tuan Adam and also Tuan Jamila. And we thank both of you for sharing. I believe the support of family and friends can really help. Like as I mentioned before, it does really play a big role. So a question for Honaja, Jamila, as a carer, what kind of support did you give to your husband, and also what else did you consider to be the key to his recovery? And maybe I don't know, you can share a bit of or what kind of other supports did you receive from everyone else? Yeah, Honaja.
Okay, like I say, we only have each other here in Brunei. So I reckon whatever support he needs is from me, besides the doctors and nurses. All. I think words of encouragement would make his day. I see it in him. My husband is, he likes to be pampered. He likes to say, whenever I say, "Oh, you're not looking so pale today. You're looking, there's some real flush in your cheeks," and then he was like so happy. So it makes his day. So I reckon it's good. Of course, it's good. Even we, the healthy people, when people praise you or people say word of encouragement and praise and all that, you feel good. You see, so more so people like these patients. So I would like to say some words to the carers. I'm no no expert in such thing, because I myself, I'm lucky to have a good patient, I say, you see, but others might have difficult patients. Again, we got to think that these people, they do not choose to be in their shoes. They do not choose to be cancer patients. See, so we have to be understanding. What if we are in their place? We have to sort of support them no matter what. Because if you don't want to you don't want to take care of, say, your father or your mother or your husband or your wife, you're making yourself miserable, you see, because no matter what, you have to take care of them. It's good to be good, as it is. We are taught to 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 give the best to other people of what we want to for ourselves. Do good to our people what you want people to do good to you. So if you're not doing good things to people, how can you expect people to give good things to you? Huh? So especially people who are sick, please, 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 I beg you all, be kind to them. They might be fussy, weight, all that. This is normal when you're sick. You're always like short-tempered and all that. Please help them, manage them properly, and then they will have manage themselves. I sincerely feel that is the best medicine. Supportive family, supportive friends, and So I also must thank, besides the doctors and this is in PGSC. I would like to thank my friends. They're helpful too. They give good advice and all that. But but all of this is up to the Almighty God. I thank Him so much that He gives us, both my husband and I, comfort to go through this journey. We are lucky. We don't suffer that much compared to other cases which I've heard from my friends. We're okay. We manage well, and of course, most of all, I'd like to thank the Royal Highness, His Majesty, and his government for being, so kind as to support us in our fight against cancer. It will be difficult, very, very difficult without his help in financially. Thank you, Danny.
Yeah, thank you, Manaja. Again, I think we all actually felt how strongly Manaja feels about the support of family members for patients. So I think the conversation has always been about the patient or the person suffering, which is all good. But we also need to look on the other side and who's taking care of these patients. If you're that person, then you would need to do your part to support the role. And I think, yeah, the word fussy, being difficult, it's all part of the recovery process. I myself don't know what's on the other side, but I do believe that Fonaja has gone through quite a long journey, and we call this, it's something that we could learn from. So I think, thank you, Fonaja. We can actually have reached the end of this forum session. But before we move on to the Q&A, I would like to open up uh, to the floor, of the panelists, if they have any last words or advice to the audience for us right now. So I'll go probably Dr. Ravi. Any last words and advice from you?
I'm really, I don't have words to say anything after listening to Haja Jamila and the Dr. Dab, other doctors and other panelists. We started this whole thing raising the awareness about male cancers. We thought it was just like we will be discussing only about this disease and what is the screening. I go back from here learning a lot. It's just not about knowing about the disease. It's also knowing about being empathetic and being knowing about what they suffer through, how they trust you in their journey. That's more important, which I can say that this is what I learned from this. I know if I could at least impart a little bit from these messages that being healthy is just not a guarantee for your whole lifetime. We have to be healthy through the various other things like your taking care of your health by being doing exercise or obesity control or tobacco, no tobacco, all this is okay. But what happens once you get a disease? We have to be, as he said, Hada Jamila said, being supportive, being empathetic in their journey, that is most important. Thank you.
Thank you, Dr. Abi. I'll just, for the interest of time, any of the other panelists wants to give out advice and quick message?
Wow, I think that Ravi's covered pretty much everything there. So that's kudos to him.
That's
So it's fantastic. On the lighter side, I think we should, keep reminding men to be more self-aware, and perhaps next year, Danny, you'll have a big bushy mustache, so you can show it to us. It'll be quite funny to see,
yeah.
we'll make an appointment for that for next year as well, huh? I think it'll be a good month to rediscuss it again.
All right, I'll take you on that offer, and we'll see you next year. I hope to see all everyone, every male, grow your mustache, and we'll see who gets the prize at the end. Okay,
Absolutely, absolutely.
so if the other panelists, okay, so I take it Puan Najah wants to share a couple of words. Silakan Puan Najah.
Thank you. This is one thing which we got from Dr. Jamsari. My husband and I will never forget this. He said that because his PSA was like going up and up. So Dr. Jamsari was saying, "Don't worry, Haji. Your life, the quantity is already predetermined by Him, by Almighty. Only the quality of your life is up to you." Which is true. You can live another 2 years, but make it good. You can live another 20 years, but miserable. Why? And I always remember this saying from Dr. Jamsari, which is very, very true. Thank you.
Uh, so it's more towards like making the best of what you have. Okay, so if I can, I shall move on because we're gonna have a Q&A session very soon. But before that, I would like to thank to all our panelists for giving their insights and experience regarding cancer and mental health. We'll be opening the floor for question and answers, but first we have a message from PJSC's Goodwill Ambassador and Messenger of Cancer Awareness, Mr. Wu Chun. So we'll roll the video. Just a few seconds where some slight technical settings need to be done. So while waiting, very sorry. While waiting, because immediately after this, we're gonna do a photo session. Okay, it's starting.
Hi everyone, this is Wu Chun, and it's Movember month, a month where every community around the world comes together to raise awareness on men's health. I urge everyone to speak up about your health. please don't just keep it to yourself. Early detection saves lives, and prevention is better than cure. I believe that you can and you will.
All right, thank you, Mr. Wu Chun. Wu Chun is actually our ambassador, a goodwill ambassador and messenger of cancer awareness. So he's been doing a lot of work together with us for the past World Cancer Day, etc. And it's been very helpful in that forefront. So now is the photo session. Um, while we arrange photo session, everyone, you can start by putting up your Movember banner if not already. And if you don't feel like being in the photo session, that is okay. That is also okay also. All right. So I see a lot of people are ready with their banners. Let us allow the team to sort out the photo. Smile and also, yeah, great. We see a lot of people popping up. So we'll give some time for you to turn on your camera. I'll take off my mask. I've got some kind of mustache also in support. All right. When we're ready, then I'll open up my mask. Okay. I think we can start with the first page. Wait, let me just. So for those of you who have yet to know how I look like, this is how I look like. Okay. So Dr. Jam next year. Okay. Ready, wait. We're taking the photos. 1, 2, 3. Okay. We're gonna move panel by panel. So there's like we're gonna take several shots. So we don't know which panels you are in. Just pause and smile. Okay. Maybe just one more time. And smile. Okay. I take it they've told me that we've managed to get a good photo session of everyone. So we will be sending this via your representative emails. If you haven't, then you can just come and reach us and let us know, and we can send you the screenshot itself. Okay, as a closing, thank you to all our participants for joining us during this Movember virtual forum. Hey, wait, actually, we have a Q&A that I forgot to upload. My apologies. Yes, the Q&A session starts now. So a bit of housekeeping. If you have a question, please raise your hand in the hand emoticon, hand emoji, or you can just write your questions in the comment section. Introduce yourself and who do you want to push your questions to. All right, might have your first questions. Anyone? Raise your hand. Everyone's pretty much okay. No questions.
We're pretty approachable, so everything goes, to be honest.
So yeah, a question from Dr. Babu.
Yeah, yeah, it's not actually a question. It's actually a comment. I enjoyed the session today. Very good interaction session. I like the patient and the carer's perspective, which is such an important part of our learning, even for doctors, and because they're sharing their experiences and learning the other side of it. And also, because cancer, as Haja has mentioned, has been like a taboo subject sometimes. Phobia, people get scared, they get denial. So coming out and talking about it, coming forward to see the doctor, seek help, seek help from their family or their brothers and sisters or their parents, and seeking help, and then going towards seeking medical help is an important step. The first step has to be the person himself accepting it and then going to seek treatment. So anyway, it was a beautiful session. I enjoyed it. And I must thank especially the patient and the carer coming forward, to be in the public to discuss this type of things. Thank you all.
Thank you, Dato. All right. So again, if there are no questions, like Dr. Jam said, we're very approachable. So if there's no questions here, then I could probably safely just close the session this afternoon. Again, thank you so much. Wait, we have Dr. Dr. Ravi. Yes, Dr. Ravi.
At the end, I'd really take this opportunity to thank all the marketing guys. You guys really rocked the whole time. This whole week, I know I've been bugging you, and probably Wendy would have blocked me already. So, but this whole month, actually, the whole month, they have been working really hard for this Movember. First time I could see such an interaction with, and I honestly, I never thought both Adam and Haja Jamila to come forward and speak their heart out. I was a bit skeptical, maybe they will they not? But really, it was a learning thing. And all the panelists, I never knew Daniel, and Daniel was actually the rock star is Daniel in this panels. He really took away all the limelight. He spoke in such an eloquent way and really talked about the mental health issues. We never discussed this. Honestly, we never discuss. As an oncologist, we are just, you are take this treatment and over finished. We don't look at all these things. And trust me, this is from the heart. You people really did a great job. Thank you.
Okay, so pat everyone else on the back. Give yourself a good pat, give yourself a good clap. If there are any more, then I will probably just end this session quickly. Thank you to all participants in this Movember virtual forum. Thank you for joining us, taking the time, some odd 2 hours in this afternoon on a Friday. We hope that you had a fruitful interaction and insights. Again, if you don't want to, if you feel a bit shy, you want to reach us here, can reach us via email, can reach us, and we can try and get all your questions answered. Or probably the next time we have another forum, then you can ask questions there. Once again, I want to thank the panelists for being here today. Dr. Ravi, Dr. Jamsari, Dr. Dr. Aung, sorry. Also, our rock star there, Daniel. Also to Tuan Adam, thank you for sharing your stories, and also Puan Haji Jamila for also sharing your stories. So thank you. We shall meet again. Stay safe, practice social distancing, wear your mask regardless where you are, just be cautious, and sanitize and wash your hands always. So be safe, stay safe, and thank you so much. Assalamualaikum warahmatullahi wabarakatuh. Bye everyone.